The femur or thigh bone is the longest and strongest bone in the body. Like any other typical bone, the femur has an upper rounded end, a lower bicondylar end, and a long shaft that is convex forwards. The first region is the proximal end, which articulates with the acetabulum to form the hip joint. Generally, it consists of 4 parts: head, neck, and 2 bony processes, the greater and lesser trochanters. Let us study these landmarks in detail. As highlighted here, this part of the proximal end of the femur is called the head. It majorly gains attention as it is the point where the bone forms the hip joint with the fusion of 3 bones, generally known as innominate bone. It is covered with articular cartilage and appears to be smooth because of it. Just below the head is the neck-hod femur. As we move ahead, the neck is the region that is connecting the head of the region with the shaft of the femur. It is cylindrical and round, and is projecting in a superior and medial direction. A wide range of motion at the hip joint is being achieved, such as walking, as it is set at an angle of approximately 135 degrees to the shaft. Due to this specific angle, we are able to move the hip joint. As for the bony processes, there are 2 at the proximal end. The greater trochanter can be clearly observed at the anterior aspect and just lateral to the neck, as highlighted here. Second is the lesser trochanter. The name already shows that it is smaller than the greater trochanter. Projecting from the posteromedial side of the femur, just inferior to the neck shaft junction. There are 2 bony ridges that connect the 2 trochanters. Intertrochanteric line. It is a line or a ridge of bone running in an inferomedial direction. On the anterior surface of the femur, it extends between the 2 trochanters. It is known as the pectineal line after it passes the lesser trochanter on the posterior surface to which the pectineus muscle attaches. Intertrochanteric crest, located posteriorly on the femur surface. This is a ridge that is connecting the 2 trochanters. That is all about the proximal end of the femur. Now let's look at the shaft more closely. The second prominent portion is the shaft of the femur, which descends in a slight medial direction. If we look at the posterior aspect of the femur, the surface of the femoral shaft is rough and has ridges called linea aspera, of the bone derived from the Latin word meaning rough line. Proximally, the medial border of the linea aspera becomes the pectineal line. As it splits distally to form the medial and lateral supracondylar lines, a flat popliteal surface lies in between them. Gluteal tuberosity causes it to become a lateral border, where the gluteus maximus attaches. The floor of the popliteal fossa, a diamond-shaped space behind the knee joint, is formed when linea aspera widens as we move distally, ending at the adductor tubercle, where the adductor magnus attaches. Now let's look at the third and last portion of the femur, the distal end, which is characterized by the presence of the medial and lateral condyles. The medial and lateral condyles are one of the prominent features of the distal end of the femur. These are the rounded projections that form the joint and are points of articulation with the tibia. The posterior and inferior surfaces articulate with the tibia and menisci of the knee, while the anterior surface is articulating with the patella. Thus the knee joint is formed. Between the 2 condyles, a deep notch can be seen. It is known as the intercondylar fossa. At the anterior aspect, as highlighted here, you can see the patellar surface. It is the groove where the bone adjoins the patella or kneecap and forms the knee joint at the distal part. Other than the large condyles, The small bony elevations, known as the medial and lateral epicondyles, can be observed on the non-articular areas of the condyles. The medial epicondyle is the larger. Now that we have gone through the bone features of the femur, it would be easier to determine the side and anatomical position of the femur in the lower limb. Looking at the femoral bone, you can see that the upper end bears a rounded head, whereas the lower end is widely expanded to form two large condyles. The head is directed medially. The cylindrical shaft is convex forwards. Let's look at the muscular attachments, starting with the muscles that originate or insert at the proximal end of the femur. The fovea capitis, known as the small depression on the head of the femur, is the place where ligamentum teres inserts. Obturator externus muscle inserts at the internal part of the greater trochanter on the neck. Lesser trochanter is the site of insertion for iliopsoas. Intertrochanteric line, it is the site of attachment for the iliofemoral ligament, the strongest ligament of the hip joint, serving as the anterior attachment of the hip joint capsule. Intertrochanteric crest, there is a rounded tubercle on its superior half called the quadrute tubercle, where the quadratus femoris attaches. Greater trochanter is the site of attachment for many of the muscles in the gluteal region. There are two gluteus muscles here, the gluteus medius and the gluteus minimus and piriformis. There is an exception of the muscle vastus lateralis that originates from this site, unlike being inserted. Now if we look at the muscles attached at the shaft of femur. A third gluteal muscle attaches to the gluteal tuberosity, which is the gluteus maximus, which is your butt muscle. On the linea aspera, remember that we have three vastus muscles here, which help to extend the muscle. The vastus medialis, vastus lateralis muscle originates from the greater trochanter and runs down. Between them is vastus intermedialis and three adductor muscles, adductor magnus, adductor brevis, and adductor longus. However, the adductor magnus tendon has insertion site on the adductor tubercle, which is a small bump on the distal end of the femur. We also have biceps femoris and pectinis. Articularis genu muscle attaches at the lower end of shaft on anterior aspect. We can already see the insertion of the tendon of the adductor magnus at the adductor tubercle. On the distal region, we have two epicondyles, the lateral epicondyle and the medial epicondyle. On the lateral side, we have the attachment of the fibular collateral ligament of the knee on the supracondylar line. On the medial side, we have two attachment heads for gastrocnemius muscles, and this is the main calf muscle that runs down to the Achilles tendon, helping in the flexion of the knee and foot. Poplitis muscle originates from the lateral condyle of the femur, which is the deepest muscle acting solely on the knee, unlike other muscles which articulate with the ankle as well. That is all about the femoral bone, its bony features, anatomical position, and muscles. In the coming sections, we will talk about the two bones of the calf, so stay tuned.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.